Samaritan Hospital today, and I am super happy to be talking about joint replacement. Thanks for having us here today.
Oh yeah, thanks for coming.
So let me first of all ask you, what is your official title? What do you do?
I'm the clinical pathway coordinator.
Okay.
So I just organize, educate, preoperative, during, and then postoperative during the total joint replacement.
It's a big deal. This
Yes.
surgery is something that when people take this step and they're ready to do it, it is a big step. So having you, I'm
Yes.
sure, is an important part of what they need and what you're able to do. Let's talk about here at the hospital. What types of replacements do you offer?
Hips, knees, and shoulders.
The big ones.
Yes. Yes.
And as far as the physicians themselves, several that work on these different types of things?
Yes, we have 3 here at the hospital. There's Dr. Weiss, Dr. Miller, and Dr. Whitsett.
Let's talk about joint replacement surgery as a whole. So those that don't know,
Yeah.
what is it and what can you describe it as?
So the total joint replacement is a surgical procedure in which they replace damaged or arthritic joints with either metal, ceramic, or plastic, and this acts as like a prosthesis. So then the prosthesis will mimic the movement of a normal healthy joint.
Technology is a big part of this, and that's a critical part, I assume, of what you offer here at Good Samaritan.
Yes, we have the Makoplasty robotic surgery that helps assist with the knees and the hips.
So over time, what happens with these replacement surgeries has really evolved and changed.
Yes.
Can you talk about that a little bit and how it's changed?
We've had the Total Joint Replacement Center since 1999, and back then, the patients, they would come in on Sunday nights and they would stay till Thursday. Now, we do the total joint replacement surgeries Monday, Tuesdays, Wednesdays, and Thursdays, and it's about 50-50. 50% of patients go home the same day and 50% of them go home the next day. So there's not really that 3-night stay anymore.
I know technology is a big part of that, but medical care as a whole has become so much more convenient for these patients, hasn't it?
Yes.
What do you hear as far as feedback from patients, because you're the one working directly with them?
They get up same day of surgery, physical therapy, occupational therapy is working with them. It's come a long way from 1999 to 2023.
Yeah, absolutely. And as far as the facilities here, glowing reviews, I'm sure, from people when they say, okay, I was nervous, it went smoothly.
Almost every patient says, well, I'm ready to get this done, but I'm so nervous. And then after they say, well, I'm just so glad that I had it done. I don't even know what I was worried about.
Well, and knowing that makes it really easy for them to take that first step. So what should they do if they're out there and they see this and they're like, okay, it's time?
Usually they've went years, with a bad knee or hip or shoulder, they can't hardly walk anymore. It's just really debilitating. So that's kind of their first push to, okay, I need to get this fixed.
And then what should they do when they finally want to work with the provider? What's the process like?
So normally they'll see probably just their primary care provider, and then most of the time we'll just refer them here to one of the orthopedic surgeons, and then they'll get some x-rays, and then they'll determine, how bad their joints are, and then go from there.
What is the most rewarding part of your job?
Just seeing everyone improve so much, and just very thankful for the teamwork and just everything.
Yeah, I'm sure. It's nice to see people actually be able to use, walk, feel like they are able to be mobile again, I'm sure.
Yeah, like so many people are like, well, I can go out and mow the grass now, or I can, go for a walk with my grandkids now. So, yeah.
Important stuff.
Yes.
Well, that's why we're here today at Good Samaritan, once again, is to talk about the importance of what they do with their joint replacement center. This is a place where if you have questions, you definitely should be asking, and you definitely should be visiting to learn more about joint replacement at Good Samaritan. And to learn more, you can also visit their website. Good Samaritan Hospital has a great website at gshvin.com. That's gshvin.org. There you can find additional information. They're also on Facebook too, Good Samaritan Hospital of Vincennes.